For pregnant women, the anticipation of labor can be both exciting and overwhelming. One of the most common questions that expectant mothers have is how to recognize the signs that labor is beginning. While every woman's experience is unique, there are some common signs that labor may be imminent. These signs can help expectant mothers prepare for the birth of their baby and seek medical assistance when necessary. In this video, we will explore the various signs of labor that women should be aware of as they approach their due date. To help us grow our channel and reach more people, we kindly request that you like, share, and subscribe to our content. False versus true labor. How to tell the difference? It is not uncommon for women to experience false labor, also known as Braxton Hicks contractions, in the weeks leading up to their due date. While these contractions can be uncomfortable and may feel similar to true labor contractions, they are not a sign that labor is beginning. It is important for expectant mothers to be able to differentiate between false and true labor to avoid unnecessary trips to the hospital and to ensure that they receive appropriate medical care. The following are some signs of false labor. Irregular contractions. False labor contractions are often irregular and do not follow a consistent pattern. No increase in intensity. Unlike true labor contractions, false labor contractions do not become more intense over time. Discomfort only in the front. False labor contractions are typically felt only in the front of the uterus, rather than radiating to the lower back. Discomfort relieved by changing positions. Changing your position or activity level may help alleviate the discomfort of false labor contractions. No other signs of labor. False labor contractions do not typically accompany other signs of labor, such as the rupture of the amniotic sac or the release of bloody show. True labor is characterized by regular and increasingly intense contractions that lead to the birth of the baby. The following are some signs of true labor. Regular contractions. True labor contractions are regular and become progressively closer together. They typically occur every 5 to 20 minutes and last between 30 and 90 seconds. Increasing intensity. As true labor progresses, contractions will become more intense and may be felt in the lower back as well as the front of the uterus. Change in cervical dilation. As the cervix begins to dilate, it may become thinner and more effaced. Your healthcare provider can check your cervical dilation to confirm whether you are in true labor. Rupture of the amniotic sac. When the amniotic sac ruptures, you may experience a gush or trickle of fluid. This is often referred to as your water breaking. Bloody show. A discharge of mucus tinged with blood is often a sign that true labor is beginning. Pressure in the pelvis. As the baby moves down into the birth canal, you may feel pressure in your pelvis and rectum. Apart from the signs of true and false labor, there are other ways to recognize labor. Here are some additional signs to look out for. Nesting instinct. Many women experience a sudden burst of energy and an urge to clean and organize their home in the days leading up to labor. This is known as the nesting instinct and can be a sign that labor is approaching. Diarrhea. Some women experience loose stools or diarrhea in the days or hours before labor begins. This is thought to be caused by hormonal changes in the body. Backache. Backache can be a sign that labor is approaching, particularly if it is accompanied by contractions. Flu-like symptoms. Some women experience flu-like symptoms, such as nausea, vomiting, and diarrhea, in the days leading up to labor. This is thought to be caused by changes in hormone levels. Increased vaginal discharge. As labor approaches, you may notice an increase in vaginal discharge. This can be normal and is often a sign that your body is preparing for birth. Baby drops lower. In the weeks before labor, the baby may drop lower into the pelvis. This can make breathing and walking more comfortable, but may also put more pressure on the bladder and cause more frequent urination. Am I going into labor? Should I call the doctor? It is important to keep in mind that labor can progress quickly or slowly, depending on the individual woman and her pregnancy. Your healthcare provider can help you determine the best course of action based on your individual situation, and can provide guidance on when to go to the hospital, when to stay at home, and what to expect during labor and delivery. In general, if you are experiencing any of the following signs, you should contact your healthcare provider or go to the hospital. Contractions that are becoming more regular, intense, and painful. Rupture of the amniotic sac, your water breaking. Heavy bleeding or spotting. Severe headache, vision changes, or abdominal pain. Decreased fetal movement. It is always better to err on the side of caution and seek medical attention if you are unsure whether you are in labor or experiencing any concerning symptoms. Subscribing to our channel is the best way to stay up to date on our latest content and receive notifications when new videos are posted.